The Trump administration wants to use its regulatory authority to allow states to drop their Medicaid transportation programs. This is known as non-emergency medical transportation. This has been a benefit that comes with Medicaid since Medicaid started in the 60s. It's based on the premise that people have no value of having health care coverage if they can't get to their appointments. So transportation to get people to care is necessary for people to have effective health care in the first place. So transportation has been a long part of accessing health care and coverage, but we know there are so many barriers to accessing transportation. Barriers impact low-income and chronically ill patients the most, and there have been numerous studies on this over the last several years. One study points to 25% of patients missing appointments due to transportation problems. There are about 25 studies that project a range of patients that reported transportation was a barrier to health care access, and those numbers reach up to 51% of patients reporting transportation as a problem. And we have new data as recent as 2015 that says Medicaid non-emergency medical transportation was most commonly used for patients to access behavioral and mental health care. It's needed, it's troublesome, and it's a necessary benefit. So even though it's so hard to do, states are trying to provide a medical transportation program in each state. And we're talking about this now because in the last Trump budget for fiscal year 2019, that gives the Center for Medicare and Medicaid Services regulatory authority to allow states to say, hey, Medicaid transportation is optional. We don't have to provide this. This has advocates raising the red flag all over the place. And we have a hard time getting patients to their care now. We know it's especially hard for mental and behavioral health treatment for those patients in particular. And now Trump is going to let states say we're either going to provide it or we're not. To date, CMS has also been chipping away at the Medicaid transportation budget by allowing states to submit waivers to not have to provide the benefit. Now, the waivers do say that it has to be for the non-disabled adults in the states of Indiana, Iowa, and Kentucky, but they're chipping away at the edges of the Medicaid transportation program. This is something we'll be watching. It's something that I'm sure a lot of companies will take issue with. There are companies that contract with states to provide these services. You can bet they're going to have something to say about contracts being reduced since this is their business model. But certainly patients and providers alike. A lot of providers are paying cab fare and rides for patients to get to their appointment, knowing that they can have a better continuity of care relationship with their patient if they can see them more regularly. And if they can't get a ride to the appointment, they can't see them. So this is a hot topic. I'm sure you have an interest in it, and let us know what families you're talking to are saying about it as well. You can read some of these things for yourself. The 2019 budget that talks about removing non-emergency medical transportation as a required Medicaid benefit. You can read a couple articles and blog posts that have been written on it. And I mentioned some of those reports and studies, and we link to a couple of them here so you can see some of those statistics for yourself. If you have questions on this topic or want to share a story, you can do that by visiting healthwatchwisconsin.org.